All right. Hi, everyone. My name is Aisha Osmani. I work in the Office of the Provost. I'm the International Travel Safety Manager. Thank you, Kelly, and the International Center for inviting me for the Global Wolverines session. Definitely happy to go over our topic for today, staying safe and healthy while abroad. So in terms of just what we want to go over for today's session, we're going to go over U of M travel requirements, resources to best help prepare you for your travel experience. We also want to make sure that we focus on what is well-being abroad and how to mitigate risk abroad. We, of course, aren't going to cover every type of risk scenario you might face in your host country, but rather we want to develop that toolkit for how to approach different issues abroad. And then finally, we're going to do a couple of practice scenarios so that you can get sort of, as you prepare for your experience, you kind of know what to anticipate when you're abroad. So before we start off, I wanted to sort of get to know our audience today. So if you could share what's your major, or if you're a U of M faculty or staff member, you can share your department, what destination you are traveling to or planning to travel to, and then what type of experience you are doing if you already know what you're doing this summer. So I'll give it a few moments as everyone types in the chat. This is exciting. So you're going to Poland for an internship. And for those who just entered, we're just doing a couple of introductions. And on the screen, you can see the prompts. So yes, hopefully everything goes out smoothly. Poland as well. So yeah, so at least some collaboration, global health in Ghana, and then research internship as well. So lots of fellowships or volunteering or internships. That's exciting in India. So classes, so summer classes in France, Indonesia for an internship. Seems like everyone's going across the globe, so it's exciting to see. An intensive language program in Taiwan, that would be very exciting to my colleague. He lived in Taiwan as well, and so excited to see that. So Chile, Ecuador, we got South America represented now. But yeah, thank you again for sharing. It's good to see sort of a wide variety of locations, definitely similar experience in terms of internships or language study, for example, in Jordan. So it's good to see that there are different backgrounds. And like someone said initially, hopefully everything turns out smoothly and you are able to go abroad safely. And again, if you have any questions, feel free to put them in the chat. Kelly will be helping monitor the chat for me. So if you have any questions, feel free to put it in there as we go along. So just to go over a little bit of what is U of M related travel. So U of M travel requirements will vary if you are traveling for UMRT or U of M related travel or not. So this is sort of the definition, and it can meet any of the following criteria. So if you receive in-residence academic credit, so not transfer credit, if you are receiving funds from U of M or it's managed by U of M, if you need to do this specific experience to achieve a degree requirement, if it's organized by a sponsored student organization, or U of M managed. So if any of these criteria are met, then you are on U of M RT. And I know students who are participating in the Global Wolverines series, if you complete the whole series, you will be receiving funding for your GeoBlue health insurance. So in this case, you'd also count as a U of M RT travel. So let's say you are on U of M RT. In terms of your requirements, the first is registering your travel in the U of M travel registry. Anyone can do it, so even if you're not on U of M RT, you can still register. It's always a good best practice to do so. And then the next thing you should do is check the corresponding travel risk rating for your destination. So certain destinations have elevated risk, and so those require, for example, a travel health plan or a safety plan that will ask you specific questions about your travel plan and sort of risk in that destination. The next thing is you must also enroll in travel abroad health insurance, and we'll go over in depth later on of how to use that insurance. You also want to make sure that you are working with your school or college to see if you need to complete any of their requirements. And then finally, there's a link here about additional considerations for international travel, which you'll have access to once we share these slides about just the context of travel now in a post-COVID period. So I mentioned travel registration. So what is the purpose of travel registration? It allows U of M to contact you in the event of an emergency. So if something, for example, happens like an earthquake or a landslide or flooding, or if there was protests, we might send you an email to confirm your status. So if you receive a message like this, we actually just sent one or two today, actually one to students in Israel and one to students in Ghana because there was flooding. So if you do receive an email like this, we ask that you reply to it and just confirm that your status, or if you need additional assistance, then we can provide that. Another thing is if you, for example, your main travel destination is India, for example, but you might do some side trip somewhere else outside of the country, then we also recommend traveling or to register those travels as well, just so that if something were to happen, let's say you went to, I don't know, so let's say you were in Germany and you went to Italy for over the weekend. We want to know that if something did happen in Italy that weekend, then we know that you are actually there and you can be included in that follow-up. So another benefit of registering is it gives you access to Alert Traveler. So Alert Traveler is an opt-in app that you can download and subscribe to. So through the app, you can get real-time updates such as changes in destination requirements, locations of protest, civil unrest, or anything more serious like following like a natural disaster or a terrorist attack. It can also give you destination-specific information. And so this is definitely another tool in your toolkit of just learning more about your destination. So for US citizens and nationals, you can register through the US Embassy in your host country through the State Department STEP program. So for non-US citizens, you can technically register with STEP. You just kind of put in zeros for your passport number, or you can also check if your home country has an equivalent. So this is just another, in addition to like Alert Traveler, this will give you notifications directly from the US Embassy or consulate nearest to your travel destination. And so just another way to like stay in touch. So if you aren't checking the news regularly, at least you are getting alerts from the embassy. So travel health preparation, let's go over. So as U of M students, you have access to schedule an appointment with the UHS Travel Health Clinic. So this clinic focuses on patients traveling abroad. And so the staff can provide advice based on your current health needs and where you're traveling to. So if you need certain vaccination, for example, for that destination, they'll be able to assist you with that process. And then if you're unable to go to the clinic, you can also reach out to your primary care physician and sort of meet with them to go over your own health needs and what you need for that destination. Another helpful resource is, of course, is the CDC website. They have advice based on that destination, including like vaccination recommendations as well as overall health risks. So in terms of well-being, so aside from managing your physical health, you also want to prepare for your mental health and well-being. So if you have registered your travel already, you have access to a guide called the Travel Health Preparation Guide. This guide will ask you prompting questions, and you're recommended to walk through them with like a family member, a physician, or a counselor. The goal is to best prepare travelers to replicate what they're doing here on campus, to manage their health, but in a context of abroad. So this may mean learning how to talk about your wellness needs with partners and support services abroad. Another thing is just learning corresponding medical and mental health vocabulary. Sometimes, of course, things get lost in translation. Even in English-speaking countries, they might use different terms for different things. And so knowing like what your current health needs are and how to sort of translate that into the destination that you're going to will make it easier as you're meeting any like mental health professionals or working with colleagues and classmates. Another thing to make sure is your access to medication. You always want to make sure that you have enough if you are taking prescription medication here in the US. If you do need to refill it abroad, we'll go over the GeoBlue services as well. And you also want to make sure it's legal in that country. So that's not usually like your first thought, but like certain medications are illegal in different countries of the world. So you want to make sure that if you need an alternative before you go abroad, that you're kind of doing that early in the process. And finally, being aware of travel escapism. So this concept is understanding that traveling to a new place is not necessarily a way to escape physical or mental health concerns, but it's simply a different environment where these could still exist and require additional planning to manage them. So one good resource is the Resilient Traveling website that many U of M colleagues put together, and it's module-based about how to sort of adapt to a new environment. So we're going to pause here a little bit and just do a practice scenario. Feel free, I'm going to go over a prompt and ask that you sort of either you can share it in the chat, or if you're comfortable, you can unmute yourself about sort of advice you would give to this student. So during the internship, Wyatt is very quiet, has difficulty waking up, and does not seem to be adjusting well with his coworkers or work environment. He shares comments recently that seem negative and possibly depressing. What could Wyatt do in this situation? So I'll give it a few moments. You're welcome to put it in the chat of what next steps Wyatt could do, or you're welcome to unmute yourself too. And the names are based on my coworkers, so my apologies if it's someone's name in the audience. Yeah, so definitely reach out to health services if they can connect the student to a therapist or a counselor. Definitely there's in-country resources, and we're going to go over them shortly, as well as U of M resources that Wyatt could tap into as well. Yeah. So reach out to like everyone's saying, mental health resources. Sometimes there's online telehealth resources, whether that's just self-guided or actually connecting to a direct medical professional. talking to a medical health professional, seeing if there's medication. Sometimes there might be medication needed in that situation. So a professional is needed for that conversation. Get with a buddy. Yeah, sometimes peer support is actually more valuable than a mental health professional. And sometimes if you are going by yourself, it might be a little bit tricky, but if you did make local connections, then reach out to them. Sometimes just listening to someone and just talking to someone just realizes that you're not alone in this. And then if they use CAPS on campus, we'll go over, you will, definitely, thanks for pointing that out. There will be telehealth services available even while you are abroad. So great answers, everybody. So most of it, everyone is covered. So if you are going on like an independent experience, definitely you have to be a self-advocate for your own well-being. You have resources, back at U of M, you have resources in country, but sometimes you're the one that will have to initiate that conversation. And so it's really important to take that step, especially for more independent experiences. So moving on. So the next few slides, we're gonna go over travel abroad health insurance. And so it's not the most exciting topic, I know, but it's definitely the one that we get the most questions about. So GeoBlue is the U of M travel abroad health insurance. It is required for any U of M participant on U of M travel. The good thing is that GeoBlue has pretty extensive coverage. It will cover the cost of like doctor visits, hospital visits, telehealth appointments, any medication that is prescribed to you while you are abroad, mental health support, any emergency evacuation, whether that's medical or political or for natural disaster reasons. So it's a pretty good coverage, probably better coverage than my own personal insurance in the US. Another added benefit is the post-departure trip interruption benefit, or PDTI, and that provides a reimbursement process for transportation, lodging, and food expenses incurred if you are required by a government mandate or a physician to self-isolate due to a positive test result from an infectious disease. So, for example, if there is a mandatory isolation in your destination for COVID, then this is another feature from this insurance that you can potentially recoup those costs that you might incur. So in terms of pre-departure, so once you enroll in GeoBlue, there's a few steps that you can take before going abroad. So the first thing you need to do is register your account. This will allow you to have access to all the online features. You still are covered technically even if you don't register, but registering before you go abroad just gives you ease of access that you can see all the online resources beforehand. Another thing you can do is download the app. So you can access GeoBlue through their website, but if you have, cellular service and data connection in your destination, you can download the app as well before you go abroad. Another thing is you can go to the member hub. So on the member hub, the online portal, you can access to health and safety tools about your destination, determine where the nearest medical facilities are. If you need, for example, access to certain medications abroad, you can check with GeoBlue if it's available in that country before you even go. So in terms of when you are abroad, if you need to receive medical treatment, what are the main steps that you should take in order to use this health insurance? First, of course, you want to determine which medical provider you're going to go to. So you can use the app or the website to find either the nearest provider, or depending on your condition or specialty, you can find a medical provider in that specialty. Second, of course, depending on the circumstance, you can either go to the nearest clinic or hospital, or schedule an appointment by using the contact info provided. So if you have time to do so, you can contact GeoBlue to arrange direct payment, and that can be done through the app or the website or calling them. Otherwise, you'll have to pay out of pocket and then file a claim for reimbursement at a later date. So in the event, of course, of a medical emergency, don't worry about, going on your app and seeing who's a GeoBlue provider, who's not. Just go to the nearest physician or hospital to seek care. Once the situation stabilizes, then you can contact GeoBlue, and then GeoBlue can work with you directly to provide assistance with that direct payment. Right. So in terms of providers, so just like with US insurance, there are participating providers or in-network or non-participating providers or out-of-network. So if you find an in-network provider, you should not be expected to pay out of pocket. It should be fully covered by GeoBlue. GeoBlue works with that hospital or clinic, and all the payment process happens behind the scenes. If you go to a non-participating provider, in these cases, you'll be paying out of pocket. So make sure you keep a copy of your receipt and file a claim for reimbursement. And the receipt can be written in any language. It could be handwritten as well, as long as it states what services were rendered and how much it cost. And then finally, if you are going to a non-participating provider, you can submit the claim via the GeoBlue app on their website, or you can fill out a claim form and email it to GeoBlue. So the main thing is you're covered either way. The difference is whether you're paying out of pocket initially and then getting money back, or you're not paying anything out of pocket and the cost is covered. So in terms of telehealth services, GeoBlue has two services that they provide. So one is TeleMD, and this offers like medical guidance for non-medical emergencies. So for example, like if you had like a simple cold, you didn't want to get out of bed, you can, schedule an appointment on the app and see who's available. Usually from what we are hearing, it only takes like a few hours to get connected to a professional. So that's definitely an option if you are unable to go to the hospital or clinic right away. Another thing is the Global Wellness Assist service. It provides counseling support for managing life changes, harassment, stress, anxiety, and you can access that on the GeoBlue member portal, and it will explain how to access these services. So we finally got over the travel health insurance. We're now going to switch gears a little bit and talk about travel and on-site considerations. But before we do that, I just wanted to do a little bit short true and false quiz. I'll read each prompt and then feel free in the chat just to state true or false. So in Japan, bringing Sudafed can get you arrested. Feel free to answer either true or false in the chat. Okay, we got a true with a question mark, so maybe. Okay, a couple more people saying true. I think I know some of these might be a little trick questions, but in this case, yes, it is true. Bringing Sudafed can get you arrested, and that goes back to the earlier thing that we were talking about, just making sure medication is legal in your host country. So Sudafed in the U.S., I think right now they require you to like provide your driver's license, but in Japan they take it a step further. It's not allowed. And so if you have certain medications, even over-the-counter medications in the US, you want to make sure that they are available, first of all, and if they are not, what alternatives are allowed in that country. Second question, in Singapore, chewing non-therapeutic gum is illegal. Who thinks that is true or false? So someone put true, some people put false. So a couple more false. So in this case, it is actually true. So non-therapeutic gum is actually illegal in Singapore. And this was actually implemented in the early 2000s due to the SARS outbreak in Southeast and East Asia. And so something as what we think as innocuous might be actually illegal or not allowed in that destination. And so paying attention to what are the local country laws. I picked, of course, ones that were a little bit more unique, but in general, just paying attention to what could be different to your experience in the U.S. To what it is abroad. Those are the ones that you kind of want to focus on to see how it's going to impact your study abroad experience or internship experience. And then in Italy, or Venice specifically, you are not allowed to feed the pigeons. True or false? Okay. Annabelle kind of figured out where I was going with these. So actually, yeah, for both Venice and for Mexico, they are actually all true. So you figured out where I was doing. And so of course for these, again, the main point is just checking what the law is in that country. And it kind of leads into my next point in terms of pre-departure preparation. Learn about your host country. It's not just limited to the laws and what's allowed, but just learning about what are the customs in that area, what are the cultural considerations. This is specifically a health and safety session, and so we want to focus on what are the risks in that destination, what are the transportation risks, what are the health risks, are protests common in that destination, and if you need to sort of plan alternatives. And so researching about your host destination, of course, you want to be prepared academically or professionally for your experience. But the main thing about health and safety is if you prepare for health and safety, then your academic and professional experience will be worth it. And so you don't want to be worrying about those things. We want you to enjoy your experience. So once you learn more about your destination, then you'll hopefully have a very enjoyable and enriching experience. Of course, check entry and exit requirements. This, of course, during COVID was especially important from a context of COVID entry requirements. But just in general, just take into account your passport and your visa requirements for that destination. Some destinations still have proof of vaccination is required. As international students, definitely working with the International Center to see if there are certain processes that you need to fulfill for US visa requirements as well. Contingency plans. So it's always good to have a contingency of if you face, for example, travel disruptions, if you have unexpected financial expenses, and so forth. So some of you might be with a colleague, some of you might be on your own. But if you have, in-country support, definitely rely on others. But in general, just have a plan in mind of what you would do in those situations. And then make sure you're all set in terms of logistics. So packing, these are just links to just helpful packing tips, preparing for the arrival, just travel abroad basics that you just want to go over so that when you arrive in the destination, you're not going to be as surprised as you are. And good question. So are there any guides produced by U of M? So there's no direct guide. The closest thing we have is probably if you have a higher risk destination, we do have the safety plan, and right now it's they're examples of those public on the Global Michigan website, and I'll follow up with Kelly and share links to that. And it asks like prompting questions that you can think about. And so it won't be like step-by-step guide of what to do, but it will have a guide of like what things to think about in your destination. But if I see of anything else, then I'll pass that along as well. Okay, best practices for on-site. Transportation is definitely probably the most riskiest thing that we hear about abroad. You don't think about that as the riskiest thing, but it is important to check, the reliability and safety of your transportation options. So if you are walking, pay attention as you're crossing the street, especially if the drivers are driving on the left side of the road. Cross at designated crosswalks. If you have a set route like to and from your housing accommodations, make sure you have an idea of what are alternative ways to get there in case like your regular form of transportation is not available. Communication steps. Make sure you have a working phone. This could be, for example, getting an international data plan or roaming plan on your phone, getting a local SIM card. Some of you might be only connected to Wi-Fi, and that's fine. I know it's very costly sometimes to get an international phone plan, but if you are doing Wi-Fi only, try to, if you can, travel with someone who has a working phone, especially if you're like, going out at night, then at least you have a working phone nearby. So take that into account as you are planning out your schedule, planning out your logistics. That communication is going to be the most important thing in terms of one, not only just navigating your area, but in case of an emergency, you do have the ability to call someone. Healthy habits. So definitely during COVID, this is probably drilled into you, but maintain good hygiene and wash your hands regularly. Take food and water precautions. That's going to definitely vary based on your destination. But it's, fairly normal on travel, regardless of where you go to get upset stomachs. But if it's more serious, then you want to check with a medical professional. In terms of environmental, so take into account the weather and the environment. If you're going to a hot location, or going to be in the sun a lot, you want to wear bug spray or wear sunscreen. If you're around a lot of insects, you want to wear bug spray. If they're like stray dogs or cats on the street, you might not want to approach them because there's always a risk of like getting bitten. So you want to take that into account depending on your destination. So these are just general safety tips. It's going to vary based on your destination, but these are just best practices that we always recommend. Avoid going out alone at night unless you're comfortable in that area. It's good always to let someone know about your travel plans. Like, let's say if you have a roommate, you're like, hey, I'm going to go across this street to the convenience store. I'm going to be back in like 20 minutes. Maintain situational awareness as you're walking down the street. You kind of want to pay attention to what's happening around you. Don't be like staring at your phone or have like, headphones on. You want to just be able to see what's happening around you. Another thing is if you are confronted by anybody, that you don't fight back. In most of these cases, just give up your valuables. If they want your phone, just give it to them. Your life is more important than your phone. And then watch what the locals do. The best way is just to observe them. It's a good idea of what are best practices in that area. So we're going to switch over to emergencies. So now that we have sort of what are best practices, we're going to learn a little bit about different types of emergency situations. If anyone in the chat wants to share an example of a perceived emergency, that would be helpful. So it's an event that doesn't directly impact the participant. So what could be a potential example of a perceived emergency? Yeah, so protests in the capital of the country, but you're in another city. And so that's very common of what we're hearing in the news right now. So there's protests happening, let's say in France, there's a lot of strikes and protests happening, but where you are, it's a little bit further removed. So that's a good example. A non-emergency, so an incident or event that impacts the participant, but is not urgent. So this could be, for example, let's say there was that protest and it's on your way to your internship. So it might affect your route to work. Like instead of taking the subway, you might be taking the bus, or you might need to take an Uber or taxi. So it's impacts you, but it might not be an urgent issue. And then of course an emergency is urgent and it's important to get that assistance right away. And so emergencies, of course, can come in different forms. And so they're generally considered urgent and serious. They can be like a serious illness, injury, or hospitalization. A student could be missing. It could be severe psychological or emotional distress. It could be related to a crime or a political crisis or natural disaster. So in terms of emergency protocols, these are just 3 steps that we always recommend to our travelers. First, you always want to attend to your immediate safety or medical needs. So if that means going to a hospital, just go to the hospital. If it's physical safety related, do what it takes to get to a safer place while determining next steps. Second, so after attending to immediate safety or medical needs, it's best to connect with local contacts and support networks on the ground to brainstorm a response plan. So local people, even if they're not professional emergency responders, often have a better understanding of how to navigate the country. So if you, for example, many of you mentioned you're doing internships. So if you have a supervisor or coworker that you can reach out to them and say like, hey, are you familiar with the process of, getting a new passport? Or do you have recommendations for seeking mental health, professional help? And they can kind of advise you of like if they have experienced it themselves or navigated that process. They can just give advice on their own experiences. And the last step is to contact U of M and to provide an overview of what's happening and discuss next steps. And so you can call U of M DPSS. So this one listed right here is the Ann Arbor number specifically. So I recommend everyone saving this number on their phone. If you call this number, you'll be connected with the DPSS team and they'll redirect it to an international emergency responder. And then for non-emergencies, we have an email listed here, so you can contact that or any U of M unit contact that you might be working with. And then we're going to end with resources and then go over a couple of scenarios to finish this out. So in terms of resources, like I mentioned, if you are working with the U of M department, like an advisor or academic advisor, study abroad advisor, so forth, they are usually a good resource of how to navigate resources on campus and plan your next steps if something were to happen. Another good resource that as students going abroad that you still have access to is CAPS. Someone mentioned it in the chat earlier for a different question, is UWIL. So UWIL is the telehealth counseling option. You have up to 6 appointments that are free, and you'll still have access to that while you are abroad. Silver Cloud and MyTalk, these are self-guided resources that you can independently explore. If there is an emergency, you can also call CAPS after hours to reach out to a counselor for a more pressing situation. SAFEPAC, so Sexual Assault Prevention and Awareness Center, they provide crisis intervention, advocacy, and support, and referrals to counseling. They also have a 24/7 crisis line in which both students or any on-site person can call for direct assistance on how to support yourself or a survivor. Other resources are student life resources are Dean of Students, the College of Engineering, if there are any College of Engineering students, has an equivalent as well called the Care Center, Spectrum Center, OSCAR, Office of Student Conflict Resolutions, SSD, which is Services for Students with Disabilities, and other resources. So when you have access to these slides, please just look them over and know that you still have access to these U of M resources when you are abroad. And then GeoBlue, I just put the links there so that you have them. International Center, of course, if you are international students, then you're kind of familiar with the process, but just definitely touch base with their team before you go abroad. They also, I've linked their visa section, and so technically there's no main person on campus that supports students applying for visas abroad, but the International Center has a nice resource that kind of explains a good step-by-step process of how to start. And then Global Michigan, we have additional travel planning resources. So let's practice again. Again, you can use the chat box or you can unmute yourself if you want to. So here is the second scenario. So during free time after work, Janelle heads to an outdoor cafe with a friend. A person in a scooter drives by their table and quickly grabs Janelle's purse. It contains her wallet, cell phone, and passport. In terms of the questions, is it an emergency or not? And what next steps should Janelle take? So I'll give it a few moments for people to respond in the chat. And then if you want to unmute yourself, you can. So Michelle is saying this is an emergency. She has lost all contact and identification. In terms of her next steps, she can contact her embassy or consulate and the local police. So, and then Annabelle is saying it's an emergency because she's a victim of crime and is missing her ID. So yeah, definitely next steps are very clear of, she's a victim of her crime. So, contacting the local police, potentially for reporting the crime, and then connecting with the embassy or consulate to get a new passport. In terms of emergency, yes, it can definitely be emergency because, she doesn't have access to her phone or wallet. If she could be in a financial situation, if that wallet contained, all the money she needed, either credit card, debit card, or cash for her living expenses. Her cell phone, again, that's her main form of communication, and then passport. In terms of timeline, it could be at least if she was leaving for the airport the next day, then it's definitely more urgent, like if she needs her passport right away. But if you are there for several weeks, then, at least you have a little bit more time of working with the consulate to get a new passport, canceling your credit cards and debit cards and so forth. So definitely good responses. So the next prompt is, Patrick typically takes the subway between his housing accommodations and his study abroad center. On his way back from evening classes, he notices the entrance to the subway station is blocked by protesters. He checks his phone and notices that the subway train is about to leave in 5 minutes. Otherwise, he'll have to wait 45 minutes for the next one. In this case, is this a serious situation? And what should Patrick's next steps be? Yeah, so Annabelle brings a really good point in terms of like how serious is the situation. You have to evaluate the level of civil unrest and intensity of the protests. And so if it's just kind of like depending on your location, like for example in Peru, there has been ongoing protests for the last 3 or 4 months, and they can get pretty violent, or the police response can be pretty violent. And so it could be in that situation, it's serious. In other situations, protests might be peaceful. But you never know what direction it's going to go with protests. And so it's always good to take into account of, okay, if it's an option for me to avoid this situation, maybe that's the better alternative. But again, you have to weigh of like what's your alternative transportation options. Are you in a safe area to wait another 45 minutes? Potentially Patrick could go back to his study abroad center and wait there. Or if he has access to a taxi, maybe that's an option if he doesn't want to wait that long. So definitely you have to weigh the circumstances of that area. But in general, protests in the US tend to be, at least on campus and the diag, those aren't serious protests in terms of like, could it escalate? The causes are important, but in terms of escalation, it's unlikely. But abroad, you never know what could happen. And so, in general, our best advice is avoid protests. I know sometimes it's just intriguing just to see what's happening, but it's always good to avoid it just because you never know if they could escalate, if the police response will be more serious in that situation. So that's it in terms of content. Thanks you again for engaging in the chat with the scenarios. And then I'll pause here if you have any questions.